Hey guys, it's Dr. Nate here at Thrive Dental and Orthodontics, and what I've been asked to do is answer the 3 top questions that I get asked here all the time, or the dentists here get asked all the time at the office. So number 1 is, and this is kind of weird to me, but what I've been asked a lot is, when you remove the braces, do you remove all the glue? And the answer to me seems very obvious. Of course we do, unless you're a terrible dentist. Of course you're going to remove all the glue. But then what I realize is people are asking me about these scars on your teeth. So what happens sometimes is after you take off the braces, you get these nasty kind of white, brown, just yellow scars, and they look kind of like this. And I always give this little pamphlet here to our patients when we start out, because that is very serious. So if they do not brush, floss, use proper mouthwash, their teeth can come out like that. And what that is that's food getting stuck on the braces. And if it gets stuck on the braces and you're not brushing or flossing or getting all that stuff out, then it's going to kind of eat away at the teeth, and it demineralizes the teeth. So what happens is, when we take off the braces, you have these like kind of yellow, white, brown scars around where the braces were. So it almost looks like, we left some glue or something on there, but it's actually not glue. That is now what the tooth looks like. And so the only way to get rid of that is have the dentist help you out with a cosmetic procedure, something that can kind of eat away at that tooth and then put something else on there. So that's a very serious thing. So yes, the glue is gone, but the tooth is actually changed sometimes. And that doesn't happen in everybody. That probably happens in maybe 4 or 5% of the people, but it does happen. And so that's why we harp on your hygiene all the time with braces. It's not just because we want to do that because we want to be annoying. It's because we know the consequences that can happen later. So that's number 1. Number 2 is, what is the weirdest, oddest, most unusual thing you have seen in your career? And this is kind of interesting to me because sometimes people think it's unusual because they have a tooth stuck here, all over here. I've had people with like 2-3 teeth stuck all over the place. But that's actually not that unusual for me because I see that basically every single week. So that's not that unusual. But to me, the most unusual thing is, and this may not be that unusual to everybody else, but we saw somebody with 9 wisdom teeth. And I just thought that was crazy because most people have, like I had 3 wisdom teeth. Some people have 4, maybe 5, but 9 is unusual. I haven't seen it before and I haven't seen it since, nowhere near that many. So to me, that was the most unusual, interesting thing that I've seen in my career. The third thing, but this is the thing that gets asked by far the most, is how the heck do you do dentistry or orthodontics? Because looking at somebody's mouth is disgusting. And that is kind of funny because yes, the truthful answer is sometimes it is kind of gross, but this brings me back to my college days when I was a porter at the hospital. So my dad's a physician and I was kind of helping out. I was transporting people from one room to the next. And I basically thought, this is kind of sad. This is kind of depressing. So I told my dad, I'm like, hey, how do you do this? Everybody's sick all the time. They're hurt. Like, what's going on? Like, how do you get over this? And he had some good answers for me. The one answer was, hey, you know what? You have to remind yourself that you are helping people. And that's actually what we're doing here, whether it's with orthodontics, with braces, with implants, with whatever we're doing. In the end, that's all we're doing. We're just helping people make their oral health better. And that's the underlying theme of everything we do. And then honestly, number 2 is just that you get used to it. And that's what he said too, you just get used to it. And that reminds me kind of dental school days, my first couple patients, when you're seeing the patients, you're shaking and you're looking inside and you're just like, oh my God, this is disgusting. And then by 3rd, 4th, 5th patient, you're like, yeah, okay. But imagine now we see 30, 40, 50 patients a day, and we're doing this for 10 years. So you just kind of get used to it and everything kind of gets normal. Even if somebody comes in with teeth that they haven't brushed for 10, 15 days, it kind of is gross for a second, but you're just kind of used to it. So that is the 3 top questions we get asked all the time. If you enjoyed this, please let me know. Please leave your questions and comments below and I will answer them. And thank you so much for watching.